the Center for Family Health. We have family nurse practitioner Tracina Christensen and support services manager Nate Nimtz. Welcome back.
Yeah, glad to be back.
Thanks for having us.
Tracina, a nurse, family nurse practitioner, and you started your career at the center.
Yes, I did.
More than 20 years ago.
Yeah, in 2001, I was actually an LPN when I started at Center, working in the pediatric department.
Wow. So you're back as of March. What were you doing?
So when I left, I was an RN,
Okay.
and I left for a bit just to go back and get my master's degree, and then they welcomed me back.
Awesome.
So I couldn't be happier.
And what we're always trying to do is avoid having to go and get treated for illness or disease. And there are some things that we can do to prevent having to do that.
Yeah.
Particularly women's health. That's
Yes.
a big focus at the center.
Yes. In our women's health department, especially now, it's Breast Cancer Awareness Month, right? So we're trying to get our patients in for their mammograms and cervical cancer screenings. So, we're recommending that our patients at age 40, most patients of average risk, come in for an appointment, and we can get them scheduled for their yearly mammogram and get them started on that process. And cervical cancer screenings, we would start at age 21. But we're trying to get everybody in just for those preventative healthcare services, before disease gets too advanced.
And do you recommend women get screened every year?
So at age 40 for
Okay.
mammogram, yes, it's a yearly screening. And sometimes patients are like, well, am I at risk? Do I need to really do this? It's always just good to come in for a visit. Come in for a visit. Let's talk about your health history, and let's talk about your family history, and kind of create a plan individualized for that person.
Did we see some drop in preventative during the...
Yeah, there was a little bit of a drop. I think people having a hard time getting services or making it to appointments or kind of falling off.
That re-engagement piece was really big, after things were kind of shut down for a while, and then once things reopened, getting patients re-engaged and sort of like back on track, and that goes for all preventative service, not just the women's health piece.
What are some ways that women in our area can access some of your services?
Yeah, absolutely. So if anyone's interested in services, they would give us a call at 517-748-5500 and ask to speak to any of our schedulers, can help them get that scheduled. And that's open, women's health services, of course, are open to the community. So
Tracina, when you think of breast and cervical cancer prevention, I have no idea. Talk me through a little bit about some of the ways that we can prevent these terrible diseases.
Sure. For cervical cancer, it would be a Pap screening, so a sample of the cervical cells. We start that at 21, like I said, but it's every 3 years. And then for the mammogram, average risk women starting at age 40, we have them come in yearly and get them scheduled to go have that done.
Besides the pandemic, what are some of the things that keep people from accessing service?
Yeah, so I would say, one of the things that my department does, so I oversee our community health workers, one of the things that my department does, or that team does really, is help patients they sort of uncover any barriers that the patients may have to care. So that could be a variety of different things like transportation, lack of insurance, maybe they're underinsured. Could even be, sometimes it's just they don't understand that they need to come in for those preventative screenings. Sometimes it's a little bit of fear. So there's a lot of different things that we find, and like I said, that the community health workers or CHWs, it's their job is to kind of help navigate that system with patients.
Yeah, I'm sure a lot of people have a lot of questions. You don't know what you're walking into.
Right.
How long do the exams take? Just out of curiosity.
Well, if they come into us, into our office, we can kind of look at their background and see what they need and what they're due for. And typical office visit, 15-30 minutes.
Oh wow, nice.
Yeah.
When you were born, Jackson had a shortage of OBGYN doctors, and moms-to-be they were jockeying for appointments. What's it like now? Are we better served in terms of prenatal care in the community?
I think we're getting there. We've had a couple of physicians retire recently, so there's been an influx of new patients coming in to establish care with us for their women's health annuals and even for prenatal visits. So, we're here if anybody needs need services. Sometimes they don't know they need to be seen, or they have questions, but they don't know where to go or where to start, and they can always just come in for a visit. Just always come in for a visit, ask questions, and we'll help them get where they need.
So we have women in the community, that become pregnant, and then they don't do anything until it's time to give birth. There's no...
Sometimes.
Sometimes.
Yeah, it's rare. It happens. It
Yeah.
does happen. Yeah.
And that contributes to our, I guess, our infant mortality statistics, which they traditionally have not been that great.
Right. So we actually have, it's good you mentioned that. So we have a community health worker, again, her name is Camille. She works specifically with our women's health population and our pregnant patients when, once they have a positive pregnancy test, she's reaching out to those patients, helping them get connected to care early on, and then really being a support person for them throughout their pregnancy, connecting them with any resources. And she's, she's went up to the hospital with a few of our pregnant patients, so it's a really great service that we're able to offer.
She does a good job
so.
reaching out and,
Yeah.
and calling patients and ask where they've been and see what they need.
Well, the other issue from the pandemic, behavioral health, and mental health, people have, I think there's been more of a focus on that, and one of the things we're learning is there's a shortage of people that are clinicians that are delivering services. How about at the Center for Family Health?
So we have our therapy services and our support services. So like I mentioned before, the community health workers, which are like our sort of case managers, that sort of role. And then we have a team of behavioral health consultants as well, who are able to see patients at their appointments while they're meeting with the doctor, and then they also do some one-on-one therapy visits too. So
It's a one-stop shop,
yeah, of course.
Yeah.
and it's for anyone. Center for Family Health.
Absolutely.
Yeah.
Healthcare for all.
Yes.
Yep.
And I think that's, even though we've been around for more than 30 years, there's still a misconception that it's not for everyone.
Right, absolutely. I think I agree with that. So yeah, we're here for the Jackson community. So
The population as a whole.
yeah.
So Breast Cancer Awareness Month, get screened, mammogram, what else, Pep?
Pap smears if you're due for it. Just come on in for a visit. Let's talk. Create your plan.
And an appointment is just a phone call away.
Absolutely.
That's great.
Good to see you both, thank you.
Yeah,
Thank you for having us.
Thank you.
Thank you.
They are providing health care for all for more than 30 years. The Center for Family Health, thanks to Tracina, Christensen, and Nimtz. More of the morning show right after this.